Hi, my name's Matt South. I'm a paramedic out of Wilkes County. I've been with Wilkes EMS for about 2 years now. Um, and the case we want to talk about is Chantel Giacalone. She was a 27-year-old actress at the time. She's now 35, but she was at a modeling event and ate a peanut butter infused pretzel, resulting in an anaphylactic reaction. So, as I talked about the patient presentation, she was presented with anaphylaxis. Obviously, she had some difficulty breathing after eating that pretzel. She was allergic to peanuts. This was known, so she knew what was happening. She went to the medics. They administered IM epinephrine, which is which is the standard of care across the U.S. However, a jury awarded her $29.5 million because the crews weren't carrying IV epi, which is required by the Southern Nevada Health District. So I just want to talk about the patient management. I think that the medics did a pretty good job. IM epi is the standard of care pretty much across the board. Everybody kind of gives their own little anaphylactic cocktail. Here in Wilkes, we give IM epi initially. If we can establish an IV, then we give IV Benadryl. If not, we give that IM, as well as albuterol, Pepsid, and Solumedrol. We can also give push dose epi in severe in anaphylactic shock when their systolic blood pressure is less than 90. I took a look at that region's protocols. That protocol seems to be pretty in line with same thing we have here in North Carolina. If a patient is experiencing difficulty breathing, then IM epi is given. If their blood pressure is less than 90, then epi 1 to 100,000 is given 5 to 10 mics to treat that and titrate it up to systolic greater than 90 every 3 to 5 minutes. So I think the crew did the right thing based on the materials they had. Obviously, I wasn't there, but I think it's safe to say that the patient suffered an anoxic brain injury because she is now a quadriplegic and can only communicate by moving her eyes. So that comes from not establishing an airway, not getting oxygen to the brain. And if the patient had any sort of blood pressure at all, she is at least perfusing her brain a little bit. But chances are that that wasn't a mistake by the crew in the sense that they gave IM epi versus IV epi. With that being said, they should have treated her airway rather by intubation, early intubation, or even a surgical crike if that is available in Nevada. I know in my service that is a step we could have took past intubation if we weren't able to establish an airway for her. But that's just kind of the discussion is, I think that they didn't violate the standard of care, rather, and I don't think they were negligent. I don't think the medics were negligent. I think that should they have been carrying IV epi? Absolutely, so they can treat hypotension. However, the standard of care calls for giving IM epinephrine. Like I said, I took a look over at their protocols, and the protocols seem to be pretty in line with pretty much everywhere that I've seen in North Carolina. I've been employed part-time at 2 other EMS agencies, and it kind of just all says the same thing. Epinephrine IM initially, start an IV, give Benadryl. If they are in anaphylactic shock, start with normal saline bolus up to 2 liters, and if you feel that it is needed, push dose epi can be given. It also considers giving dopamine, and again talks about titrating it to greater than 90 systolic. So I don't think that the crew did anything wrong here as far as their patient treatment and what they had available in them. We don't know how the patient was treated in the hospital. If she could have coded when, after she spent an hour in the ER and they didn't establish an airway. I think it just kind of comes down to the patient didn't have an airway. She was bronchioconstricted. No air was getting to her alveoli. So that resulted in her anoxic brain injury, rather than, her giving IM epi instead of IV epi. I don't think that played a role too much in her outcome. However, it is an incredibly sad case. However, the paramedics shouldn't be placed at fault here. Sometimes we're just going to have bad outcomes from patients. There's nothing we can really do about it. However, this does kind of open your eyes about, even if you do treat people to the standard of care, it doesn't mean that you're not open to a lawsuit. Lawyers are designed to sue, while paramedics are designed to save lives. But with that being said, they should have established an airway early on, gave plenty of oxygen, done whatever they could to successfully oxygenate that patient, which ultimately led to her anoxic brain injury, resulting in her injuries now. But anyways, thank you guys for your time, and have a great night.